Good morning. I would like to welcome you to the Keith M. Boyd Museum in Russell, Ontario. Today is our very first Russell historical moment. And I'm standing here in the office of an early dental practice from the early 1900s. In 1898, the railway was put in and connected Russell with the outside world. And once a week, an itinerant dentist would come to town and set up a room at the local hotel and treat patients. If you had a toothache in those days and the dentist wasn't coming right away, you would have to suffer under the treatment of our local doctor, Dr. McDougall. What he would do, he was have you lie face up on the floor. He would put his knee on your chest, and he would pull that infected tooth with a pair of pliers without any freezing. But in 1904, Dr. Philip Proudfoot came to the village, and he set up shop in his house on 44 Mill Street. He was a recent graduate of the Chicago College of Dentistry and recently licensed with the Royal College of Dentistry in Toronto. He was married to Edith Downing, and he had 3 children. And he was a dentist here for 45 years. So this is his office, just as it was in his house. It was brought over here when the museum was opened in 1989. And all of his tools and everything was here that he worked on with his patients. And his chair is here. Many people remember the dentist chair. But there's something missing in this office. I'm not going to tell you what it is right away. I want you to observe first. So he was a bit ahead of his time. He had a nitrous oxide system that would provide some relief for patients that were having a lot of pain when he was working on them. And he would collect teeth that were extracted or fell out of kids' mouths, and he would use them to make false teeth. He was sort of the first tooth fairy. You probably will know that in those early days, some people had their teeth filled with gold. And so there's a rumor that in one of these cabinets, there might be a secret compartment where he might store the gold that he's extracted from these teeth and be able to cash it in at some point, maybe for his retirement. So he would have the patient sit in this chair. He had a place for being able to spit out, as we do now in our modern dentist. But there's something missing, and that is the dentist drill. We don't have the drill that he used in those days. I'm not sure why. But the dentist drill would have been set up beside the chair, and he would work the drill with his foot. It was a very slow rotating drill, and sometimes we get stuck in the patient's tooth. Now we have high-speed drills, and it's much less of a problem. In this cabinet, we have a lot of the tools that he used to yank teeth, to set up the fill cavities, and to make false teeth. And this is a wonderful display, and I would welcome you to come and have a look at it. See if you can find that secret compartment. Dr. Proudfoot was way ahead of his time. He had spent 3 years teaching in a world school down near Van Cleek Hill, where he grew up, and before he went to dentist college in the States. And he always remembered the children and the people that he taught back then in the rural part of Ontario. And so he was an advocate for several things in education that I believe were ahead of his time. One of them is that he believed that children in school should have regular dental checkups. And so he would go into the school and be able to check the children out there. He also was one of the early advocates in the 1930s for offering French in the public school system. That should be taught there, he said. He also was a person that was interested in observing what was going on in the community. And as a dentist, he noticed that several of the children from some of the local farms had very few dental cavities. And so he did some investigation, and he determined that the local groundwater had a high degree of natural fluoride. He was one of the first advocates of putting fluoride into water systems, water treatment plants, in order to reduce the dental decay in the population. He also he was married to Edith Downing, and he had 3 children. He was very interested that in the school they should teach very practical courses in order to keep the children interested in the rural way of life and farming. And so he had a big impact. He was on the Ontario Educational Association, and he had a big impact on the educational system here in Ontario. So I would ask you to come, have a look at this dentist's office. See if you can find that little hidden place where maybe there was gold kept from the teeth of people that had lots of money and could afford to have their teeth filled with real gold. And so for now, I'd like to wish you a good day.